IPMR, the Institute of Physical Medicine and Rehabilitation, is an independent, not-for-profit, comprehensive rehabilitation center with a distinguished tradition of leadership, providing inpatient and outpatient therapy throughout Central Illinois for over 60 years.
The organization has really stood the test of time, and I think that is really a signature piece for IPMR, distinguishes it from everybody else who's out there in this business trying to provide care for the physical needs that people have.
As the Second World War ended and our troops had returned home, many were disabled. It had become clear to a concerned group in our community that these local heroes would need help in order to lead productive, fulfilling lives. Thankfully, Dr. Harold Vanaken, Caterpillar's medical director, recognized the immediate need for a plan to help our veterans and people of all ages in our community who were fighting their own battles with polio and other serious health issues.
IPMR is very close to my heart because my father, Dr. Harold Vanaken, along with Dr. Bob Rutherford, conceived an idea to help people with disabilities, that they were useful in our society.
With the help of Caterpillar, the Forest Park Foundation, and Dr. Robert Hart, IPMR, the Institute of Physical Medicine and Rehabilitation, was created as the key element in implementing the Peoria Plan. Treatment was given not just to veterans, but to victims of polio, stroke, and to others who previously had no opportunity to regain their quality of life.
Those people back then were write-offs. Nobody seemed to think there was a place for them in the workplace, but my dad felt different. He knew that they could be productive, and IPMR, with all their great staff and their great people, put these people back into the workforce.
As the first facility of its kind, IPMR attracted a variety of visitors from public officials to medical professionals from as far away as Egypt. And IPMR was recognized for taking the lead in physical rehabilitation. IPMR's leadership has continued year after year in the introduction of many new therapies, areas of service, new cutting-edge technology, and in the acquisition of valuable knowledge in the field of physical rehabilitation. Today, board-certified physicians and more than 120 physical, occupational, and speech therapists and therapy assistants, as well as gerontologists, exercise specialists, nurses, and psychologists, are serving the community in 18 locations throughout Central Illinois.
We've started many new programs since the Institute was formed over 60 years ago. The Institute of Physical Medicine and Rehabilitation was the first in the area to start pool therapy and lymphedema therapy, as well as balance therapy.
Since its inception, IPMR has looked forward to a very promising future by anticipating change and preparing to meet the increasingly complex world of healthcare. Anticipating the need for increased services to the elderly, IPMR opened Senior World in 1981, a model program for adult day service and the first such program in Illinois to be accredited. Our current plans call for providing even more services for seniors.
Well, I think IPMR has a very important role to play in providing care for an aging population. The fact is that there will be more in senior ages going forward than ever before in our history, and along with that will come some additional medical challenges, one of them being physical medicine. Being able to deal with the aches and the pains and limitations that previously weren't known to us because we weren't living long enough Today we are. In the future we will be.
Rehabilitation for seniors is one part of a larger plan to increase wellness services for all age groups.
We're trying to strive towards wellness as one of our big goals for our patients and for the people that we serve. We would like people to be on top of their health care and be physically active and work on strengthening and mobility before they develop any serious problems. That will keep them healthier longer, keep them feeling better longer, and if they should develop something more acute, help them to overcome that with a greater ease.
Life is filled with choices. How you take care of your health is one of them. Sometimes things go wrong, and life gets out of balance, like pain that changes your life. That's why we're here, to help get your life back again. For a free decision guide to help you make the right choice and learn more about pain management, visit IPMR.org. At IPMR, we feel a deep connection to the people we serve. Because every day, our patients call, email, and write, expressing their appreciation.
To be honest, this people here, this place, I couldn't do what I do without them.
The knowledge that we are truly helping our friends, neighbors, and family members in our community is what keeps us going strong. It's why we do what we do.
We always try to remember that this could be our family member, this could be us, this could be someone we love, and that's how we want to treat the people that we work with.
As an amputee and as recovering from a hip replacement, I couldn't be where I am today, back on my feet, living a pretty normal life if it wouldn't be for the staff and the people at IPMR. They're caring, they're very professional, they certainly know their job, and they push you and push you and push you till you become stronger. You can get back to what you do every day. Sure, you got a disability, but they teach you to overcome that disability. And there's no better people, no more dedicated people, and more fun people to be around than the staff at IPMR.
IPMR patient Marvin had a subarachnoid hemorrhage, also known as a bleeding stroke. He had been hospitalized for 3 months and induced into a coma for over 80 days. Marvin described it as a very difficult journey that started in North Carolina and ended up at IPMR in Peoria, where he has family.
Well, IPMR is a great place to come. You feel very welcome. The people are very nice. And the therapists are very knowledgeable. And I would say it's a great place to come, not just for recovery, but you feel like you're a part of family. I got physical therapy, occupational therapy, and speech therapy. And all of them were very helpful. It would be a very difficult journey without IPMR.
IPMR has an important message to present to the communities we serve. We have been, and will continue to be, the leader in physical rehabilitation in Central Illinois. We know success is measured by the best possible outcomes, and we will continue to offer excellent care with exceptional results to assure those outcomes. We also know innovation pushes all boundaries as we continue to lead the way in physical rehabilitation. And we will work with our patients and their families every step of the way on their journey to recovery. IPMR and its foundation are committed to maintaining a leadership role now and for years to come as we face the many challenges of tomorrow.